Hi, everybody. This is Dr. Roya, and today we are with our sixth episode about the common problems and their common treatment with Ayurvedic medicine. So, this time our topic is common cold or influenza or flu. The common treatment that I do use in my patients usually works really well to help them heal better. First, I would tell you the warning signs when you do have to go and see a doctor. But other times, if you have a common cold or flu, I can tell you how to treat it easily so that you don't have to see a doctor for that. If you have a green sputum or you have sputum with blood, then definitely you should see a doctor. If you have severe ear pain or sinuses pain, which is really with a toothache and all, then you have to do that. And also, if you have shortness of breath or you have some chest pain with a major cough, then of course you have got to see your doctor. But apart from those, the common things like a headache, body ache, feeling unwell, runny nose, even runny eyes, and earache, but not major, like feeling of being unwell, some fever, cough, especially if there are cough, then the common problem is usually virus. And so the treatment is pretty simple. Now, even if you have bacterial infection, you can still use this treatment, which I would suggest, and that would make the duration much less. So you'll feel much better faster. For flu as well, this will make it much faster better. So I'll start with that. I can tell you that during COVID, I was using this, and a lot of my patients who had COVID, they actually benefited from this very quickly, and they improved within 3 days, at the most 4 days, and they didn't have to go to hospital and all. So it was really helping. The major ingredient I use is vitamin D. So normally a person who is above age 18 would have about 2,000 units of vitamin D per day. They should take it just to keep their immune system okay. We are in Canada, so in Canada there is not enough of sun, but no matter where you are living these days, I guess it's the same thing for everybody to use 2,000 units of vitamin D per day. But as soon as you get sick with anything which is related to your chest or sinuses or ears or throat or anything like that, including the flu and common cold, then I would start with this treatment immediately. First of all, I would start with vitamin D, which would be 50,000 units for 5 to 7 days. And then after 10,000 of vitamin D every day, I would also use zinc about 50 milligram daily during the same 5 to 7 days. All of these are for 5 to 7 days. And then vitamin C. If you have lemon or lime, then you can put it in warm water and have it 3 times a day, and that would be okay. If not, then you can use vitamin C, 500 milligram daily for this purpose, or twice a day even. You can use that. Now, the most important thing is to gargle with salt and water and a tiny bit of baking soda. Just the tip of a teaspoon is the amount that you need to gargle every day, 3 times a day for the first 2 to 3 days only. So you do this before meals, definitely, and about 15 minutes after that, you make a drink and you drink that. That drink would be warm water with half a lime or lemon. I would prefer lime usually. It's easier and it's better and it's more alkaline, so it actually helps. And a teaspoon of honey if you're not allergic to honey. If you are allergic to honey, then don't put that. But if you do drink that about 15 minutes after that, it will really help boost your immunity, as well as it also kills the bacteria and reduces the viral load and the bacterial load in your throat, which is usually the source that goes everywhere else. So that would be the best thing to do. Avoid sugar during this time, like sweets and all are the thing that the bacteria and the virus feeds on. So you want to avoid all of those things. The things that you could use is either lentil soup or chicken soup or vegetable soup. Any of those things would really help, especially if you have got ginger in there. That also has got some antibacterial and antiviral properties in it, so it helps quite a bit. Make sure that your windows are open and some part of the day, and you have some fresh air, breathing some fresh air. Now, the common things that I use for my patients are oscillococcinum, which is one of the boron products usually, and it's a support system. It is a medication that really help boost immunity, and also the Stodal or Helixia. There are two of the medications that I use for cough, usually in patients. Tylenol is another medication that I use in commonly, and that would be something that I would suggest for everybody. Now, if there are children with all of these problems, then the dosage of vitamin D differs. And the vitamin D for kids who are between age of 9 to 18, normally they should take about 1,000 units per day of vitamin D. And the zinc would be 25 milligram usually per day during the time they are sick. But during the time that they are sick, they also will take 5 times of that 1,000. So any kid would take 5 times of the amount they normally take for about 5 to 7 days. It's not harmful, but it really helps boost the immunity. So about 5,000 units per day of vitamin D and 25 milligram of zinc. For them, the vitamin C, if you're not using the lime or lemon in a warm water with honey, then you could use vitamin C about 250 milligram for this age group. Now, if the age group is between 3 to 8, then I normally use 600 units of vitamin D per day for them on a normal basis. But during the time they're sick for 5 to 7 days, I would use about 5 times of that, so 3,000 units of vitamin D per day, along with zinc, which is about 10 milligram per day during the time of illness. Again, vitamin C would be about 100 milligram for them, just for the 5 to 7 days. And that would really help. Again, gargle kind of hard about age 3 and all, but after age 5, it's if you have taught them, then it would be easy. Normally, to teach them, I would suggest to use just plain water initially, and once they have learned it, then it becomes easy for them to do that gargling. I hope that helps you, and let me know if you have any questions. We would respond to that. And if you like it, please subscribe and share it with your friends. Take care and have a wonderful day.